Are you currently suffering from pain on the bottom of your foot, by your heel? That's worse when you get up in the morning for the first few steps after you've been sitting for prolonged periods of time, but as you move around, the pain gets a little bit better. If so, these are classic signs and symptoms of what's called plantar fasciitis, a condition affecting the structures on the bottom of your foot. Hello everyone, my name is Dr. Zach Greenwade here at Performance Sport and Spine in Seattle, Washington. I'm a sports chiropractor, and today we're going to talk all things plantar fasciitis, maybe why that's not the best name for it, while simply attacking this with just rest and anti-inflammatories is not going to be the most successful way to heal. And there's some other conditions that can affect your foot that are less common, but you want to be aware of. Stick around as we dive into this and give you all the information you need to manage this successfully. So plantar fasciitis affects all kinds of people, young, old, sedentary, and active. It's probably most commonly seen in people that run a lot and military people from the excessive strain of standing. One thing to note is about 1 in 10 people throughout their life will suffer from this, so it's pretty prevalent. And it makes about 8% of all running injuries, and it estimated that at any one time about 2 million people in the US are suffering from it. If you look at our foot model here, this is the bones of your foot and ankle, and this black band is the plantar fascia, and it runs from your calcaneus, or the bone on your heel, to the front of your foot. And it's a thick collagen structure similar to tendons and ligaments. Now the cool thing about this is it's actually made of 3 bands. There's a center band, the lateral band, and the medial band. But the middle band is the most common in plantar fascia, and what this does is it helps to distribute force on your foot and stabilize the foot. And what's really cool is as you press off with your big toe, it puts tension on this band similar to a truss. So as the band gets more taut, it raises your arch and it helps stabilize your foot. So this is what we call a passive stabilizer of the foot, and it's very effective for us as we walk and run. Now I want to talk to you about how to know for sure if you have this condition. So the first thing is a dull, achy throb that's sometimes sharp on the bottom of your foot, most likely by your calcaneus or heel bone. Secondly, as you get up in the morning, after sitting for a long time and getting up, the pain is going to be worse in that first few steps and then get better. And then third, as you move around, the pain continues to improve to a point, but if you push too far or too strenuous, you're going to pay for it. One thing is with ultrasound, they can actually check your thickness of your plantar fascia. And it found that people that have this condition versus not, it's more likely that it's 4.5 millimeters thick. So that's one thing you can do to determine it. Back to the pain, this study showed that when people would mark on their foot of where their pain was, it seems like the pain can be anywhere on the back third of the foot. So it's more than just that one spot. Most people get better with 3 to 6 months of conservative care, but not always. And it's about most common in one leg, but 30% of people will suffer from it on both sides or bilaterally. Some important things to know that will make your prognosis worse or decrease your chance of success is if you've had pain for more than 7 months prior to getting treatment, if your symptoms bilateral again on both sides, being female unfortunately, and then for some reason being under the age of 40 actually makes your prognosis worse. So if you're middle age in your 50s or 60s, there's actually a better chance that you get better. For a long time, we thought this condition was primarily an inflammation process, similar to tendonitis, where it's plantar fasciitis. But current research shows that it's more about degeneration than just inflammation. Inflammation probably does play a part, especially in the acute sense, so if you had it for a few weeks or days, but long-term, several months, years, it's more about mechanical overload, which causes degeneration. The fancy medical term is called mechanical transduction. And what this means is that as cells get stressed on them, they adapt, either positively or negatively. So if you think about someone that's like a military person, they stand on their feet all day long. There's way more load than the capacity of those cells, and over time they start to degenerate, which causes pain and weakness. So if you only use anti-inflammatories, you're not really treating the problem, you're just treating the symptoms. That's why the stretches and exercises later in the video are so important. There are some risk factors for this condition. So the first is elevated BMI. Again, the more weight, the more strain. Tight calves that limit ankle dorsiflexion. So as your toes come up towards your head, that's called dorsiflexion. When that happens, it puts more stress on the plantar fascia, increasing your chance. How your foot's structured also plays a role. So if you think of my hand as your arch of your foot, if you have pes planus, which is a flat foot, your arch is flattened, which puts more stress on your plantar fascia. Also, if your legs are different lengths, that can cause more stresses on one leg than the other. So sometimes putting a heel lift can really help people. And then lastly, runners can be affected by this. A lot of people run, put a lot of stress on that, And it really, in terms of the prevalence and incidence of plantar fascia, the more you run, the more frequent, the longer, the more intense, the more likely you are to do that. So sometimes for runners, just dialing back or alternating is huge. But basically, if your load is greater than your capacity, it's going to cause problems long term. You want it to be where your capacity is greater than your load, so that whatever you're putting on the tendon or plantar fascia can handle it. If you've enjoyed the video so far, please like it, make sure to subscribe to us, and click on notifications so you get future videos. Also check out our great membership program that we've offered. And one thing I want to point out is we do a lot of online sessions with people. So if you're struggling with conditions and you're not getting tailored specific diagnosis and treatment, you'd be amazed what the right stuff will do. It's far more likely that your problem has not been given the right advice, rather that it's not fixable. So with the right stuff, it can get better pretty quick. Because of all this, plantar heel pain is probably a better term than plantar fasciitis because it's more than just inflammation. You can kind of think in the acute sense, it's inflammatory, and rest and ice is going to help. But a more middle to long term, it's more about chronic degeneration and overload. So focus your treatments to treat that, not just inflammation. Now, one other thing about this that's a common myth is bone spurs. So these little bones that grow on the outside of the foot or under the foot. And historically, we thought that that causes plantar fasciitis. When we look at studies that do imaging, only about half the people that have plantar fascia even have bone spurs, and of those, only half are painful. So about 1 in 4. So bone spurs do not cause plantar fascia. That's a common myth that needs to be dispelled. Now we're going to cover the stretching portion of this video. We're going to go over several different stretches. We want you to pick 2 or 3 that are the most effective and then do it. One thing to note is we want to do these 3 times a day. It's really important that we do these frequently throughout the day, not just one time in the morning or last at night. So follow the dosage that we recommend really adherently. First stretch, in a seated position, we're going to cross the affected leg over the other. So if our pain is right here, we're going to take our first 2 fingers of this hand and place them right where the pain is on the origin of the plantar fascia. And with our other hand, grab our first 2 or 3 toes. Now, keeping pressure with our left hand, we're going to pull back with our right hand as hard as we can, making sure we feel pressure under these fingers. We're going to hold for 10 seconds and repeat 10 times, and make sure to do this 3 times a day. For the towel stretch, in a seated position with your knees straight as you can, put the towel around the front of your foot on your toes, keeping your knee down. We're going to pull our toes in the front of our foot back towards our head, feeling a deep tension and stretch in that calf. Hold for as long as you can, relax, and then repeat. And again, doing this throughout the day is incredibly important. Standing eccentric stretch. So with a small step or chairs, put your toes and midfoot on it with your heels off. Supporting with your hands, keeping your knees straight. Drop your heels down towards the floor to tolerance and hold. This is eccentric because you're kind of loading the calves in a standing position as well as stretching them. Adjust the distance to your pain tolerance and follow the dosage that we recommend on the screen. This stretch, we're going to be on our hands and knees, and then we're going to take the affected leg, cross the other one over it, and then push your butt up and drop your heel down to the floor as far as you can. And hold. Make sure to keep your elbows straight and that butt as high as you can and the heel towards the floor as much as you can. Hold at tolerance. Wall stretch. So against the wall, put the affected toe and foot up against it as high as you can, keeping your knees straight. Bend forward as far as you can, feeling a stretch in that calf. Some people might find that bending your knee a little bit and then stretching forward would be better. Find the position that gives you the best stretch. This last stretch is for big toe mobility. So remember to talk about that windlass mechanism. As your toe extends, it puts tension here. So the more mobility you have on this joint, the easier it is going to be on that plantar fascia. So I want you to support or brace the forefoot of your foot with your left hand. With your right hand, you're going to grab your big toe and pull back as far as you can, and then use your muscles to also lift your toe up to try to get as much extension as you can. Hold for a few seconds and then return. Make sure to make this foot doesn't move and just your big toe. So support with your opposite hand. With your right hand, pull up as far as you can to get as much mobility in that big toe joint. Exercises will be similar to the stretches. We're going to give you a bunch of different options. I want you to go through them and then select the 3 to 5 that are the most helpful. One thing with the calf raises, start with the isometrics and then progress. Follow the levels that we show you, and at the end, it's really important that you keep getting heavier and heavier, more intensity, rather than more reps. This collagen needs to adapt to high intense loads, so it needs to be as heavy as possible, but no heavier. Double leg isometric. So on a step or on the floor, we're gonna raise up on our toes to our heels as high as possible, feeling tension in our calves. Try to keep both heels the same height and hold the tolerance. We'll give you recommended dosage on the screen. Okay. Level 2, slow tempo double calf raise. So in that same position, supporting with the wall, we're gonna raise both our heels up as high as we can, slow tempo, 1, 2, 3. Pause for 2 seconds, 1, 2, and then down, 1, 2, 3. Make sure to raise your heel on the painful side as high as the other one. And that slow tempo, that 3 seconds up, pause, 1, 2, and then down 3 is really important. You wanna keep your knees straight and feel tension in your calves. Minimize any bending forward to the wall and using momentum. You want this to be all calf. 3. So we're gonna raise up on both legs, and in that position, we're gonna take one leg up, keeping the heel on the down leg as high as you can. Hold the tolerance, put the foot back down, return to the starting position, raise up, and then hold on the other heel, making sure to keep your knees straight and not leaning forward. Make sure that the painful side heel is up as high as the non-painful side. Level 4, single leg calf raise. So in that same position with your knees straight, raise up, 1, 2, 3, pause for 2 seconds, and then come down, 1, 2, 3. Keep your other foot off the whole time. You may need to start with only a few reps and increase as your symptoms allow, but make sure to feel the tension in your calf and not compensate with your body. For the level 5, we're gonna need something under our big toe to kind of keep it extended. In that single leg form, we're gonna raise up, 1, 2, 3, pause for 2 seconds, and come down, 1, 2, 3. We're going to show you a 5-week program, and it's very important that you adhere to this and progress all the way, making it heavier and heavier with lower and lower reps to get the full strength of that plantar fascia. Alternate to the standing calf raises is a seated calf raise. So for some reason, if you can't do those, you can start here and then work your way up. So what you want to do is in about a 90-90 position, place a weight on your foot or your leg and raise up, 1, 2, 3, pause, and then come back. Again, if that's even too challenging, you can just place your hands, apply resistance, 1, 2, 3, pause, and then come back down. Start there and then work your way up. Inchworm. So in a push-up position, we're gonna keep our knees straight and walk our toes as far towards our hands as we can, pause, and then walk back out. Now, if this is a little too challenging, what you can do is you can start with your knees bent and walk them in. And then as you develop strength in the arms, and your tolerance gets better, you can keep your knees straight, but really try to walk your foot as close to your hands as you can and increase over time. Banded foot dome. With the anchored band away from you around your midfoot, what we're going to do is try to lift our arch up towards the ceiling and then collapse it down to the floor. Make sure you're not pulling with your toes. Our foot should not move. It's just arch up, collapse down. If you want to make it more challenging, you can pull your foot farther away, placing more tension on the band, and collapse up and then collapse down. Your legs should not move, it's just arch up, arch down. The level 2 version of this is to keep that arch support in position with the band, but we're gonna stand on one leg, holding a light weight, and do a partial range single leg deadlift, really focusing on keeping that arch wherever you trained it. You can add a weight to make it more challenging, or with time, increase the range of motion. But the goal is to strengthen the plantar fascia of this exercise. Standing toe walk. So we're gonna elevate up on our tippy toes, our heels as high as we can. Start with against the wall so you can place one hand against the wall to stabilize, and then you're just gonna walk, keeping your heels off the ground, loading that plantar fascia. Go as far as you can, pause. I want you to turn around, staying up on your toes, and then walk back to work on rotation stress. So for the step up with arch support, again, think about keeping that arch like we've practiced. We're gonna put our foot up on the step, adjust the height to your current tolerance, and then step up, pausing against the wall for balance. But I want you to really think about keeping this arch elevated through the whole process and not letting it collapse down or inward. So keep that pressure, engage your foot, drive up with your leg, pause, and then return to the starting position. There are some accessory exercises for plantar fasciitis that's really important. And there's two muscles. There's these peroneal muscles on the outside of your foot, and then this tibialis posterior on the inside. And what these muscles do is their tendons run along under your foot and they help support the arch. So the stronger these muscles and tendons are, the less stress that's going to go in that plantar fascia. So we're going to show you some simple and effective exercises for those that you need to be aware of. Tib posterior, that muscle that runs along here, we're going to do the exercise in this position. So if our effective leg is the right leg, it's going to be crossed on the other leg, and the band will be anchored under the foot. And we're going to press our whole foot up towards the ceiling and down, feeling tension right along this region. Now, as we do this, again, slow tempo, pause, and then return to the starting position. Don't go fast. It's pointless. Now, common errors is as you come up, you're going to want to either pull your toes up or point them down. Make sure that your toes are out of this. This is the foot exercise. So you want to keep your foot slightly down, and your toes should not move independent of your foot or ankle. If you start to feel tension up here, you're doing it wrong. So don't let your toes come up. Again, foot is down, press up, and then return to the starting position. Two for the tib posterior is we're gonna have that band around our feet. We're gonna have some tension on that band with our stance. We're gonna let our arches collapse in, pushing out into the band, feeling our arch activate. We're gonna raise up, slow, and down, keeping that tension on the band. If it's not challenging enough, you can have a little wider stance, collapse in, press out, and raise up. For the peroneal, we're gonna be in a seated position with the band around both feet. And if this is the foot we're trying to work on, we're gonna anchor with our left and then push our toes in front of our foot out, keeping our heel on the ground and anchored. You don't want to move through the whole hip. This is just ankle down. So you want to feel tension on the outside right here, but again, slow and controlled, 3 seconds out, pause, and then in. Next one is you're going to want to bring your other foot back a little bit to get more of a diagonal stress, and then press out. Again, slow, 1, 2, 3, pause, 1, 2, and then in. You can kind of tinker with the exact diagonal, but you want to make sure it's at least 45 degrees and it's slow and controlled. Peroneal, so we're going to pull out with the band and then raise up, 1, 2, come back down. Make sure not to lean or bend your knee. You want to make tension on the band, raise up, 1, 2, come down. For diagnosis, palpation of the plantar fascia at the origin should be tender, plus a positive history. You're going to want to have a person standing to look at their foot to see if they have flat foot or those foot abnormalities that we talked about. The silver ski test, which is testing for ankle dorsiflexion due to calf tightness. There's the windlass test where you pull up on the big toe to see if it is positive for plantar fascia pain. X-rays are helpful for ruling out other conditions, but it's not needed for diagnosing this. The best imaging is ultrasound to look at the thickness of the plantar fascia due to economic and less invasive reasons. And one thing to note is this study showed that out of 116 surgeons, 74 recommended conservative care over anti-inflammatories and corticosteroid injections. So even they agree that just attacking this anti-inflammatories is not the best way. With orthotics, they have been shown to help as it helps support the arch, which the more support, less stress on your plantar fascia. Now, a couple things to note about these is they're most effective in the first 4 to 6 weeks. They're going to wane as time goes on. Custom made are no better than the ones off the shelf. Don't waste your money. There's so much research that says they're exactly the same. So you're going to save thousands of dollars or at least hundreds of dollars. And then lastly, they need to be comfortable. There's no one size fits all. So make sure you try several pairs and do the ones that are best for you. They're going to be the most helpful for people that have limited ankle dorsiflexion, lower BMI, or lower fear avoidance. So it's going to be those people that just need to take some stress off for a while till the tissues calm down. Splints have been shown to be helpful as they hold the foot in a certain position at night that takes pressure off the plantar fascia. The biggest problem with these is adherence. Nothing's going to help if you don't use it. So they're really uncomfortable. For some more stubborn cases, I would try them, but they are uncomfortable and they're probably going to affect your sleep, so there's a balancing act. For taping, it again has been shown to be helpful in the first 4 to 6 weeks. It does not matter how you tape the ankle. Don't waste your time finding this special technique. Find a position that's comfortable for you, that supports the arch, but you need to augment it with the stretches and exercises that we've shown you. Corticosteroid injections, you're really trading short-term pain reduction for potential long-term consequences. Historically, these have always been the go-to, and they are great, I get it. You have pain, you go in, you get a shot, it's gonna feel better. What they found is with repetitive use, they can damage the collagen, and since this is more about degeneration than inflammation, you actually can make yourself worse off. Interesting to note, studies show that people with the most pain have the least effect. So unfortunately, the more painful it is, the less chance these are gonna help you. I'm not saying don't do them, but don't think there's a fix-all and that once your pain's gone, the problem's fixed, especially if you have repetitive injections. PRP, which is using your platelets in your blood to make it stronger, or extracorporeal ShockWave therapy can be helpful. That's really more outside this video, but those are some options that you can think about. Now with surgery, that should be your last option. This is really invasive and it can be helpful, but there's no really good studies. So you need to make sure that when you've done everything else, high quality rehab before you do this. There's a fasciotomy where they take away some of the fascia, or other things where they try to extend or take tension off your calves. This may help some people, but make sure this is a informed consent and your surgeon is really talking to you about all the pros and cons. And if they say it's a guarantee, that's just not true. We don't have the research to back that up. Now I want to quickly talk about some stubborn cases that I've had in the clinic and that maybe help you. So this is a continuum. Some people have this mildly and some people's life will be debilitated and will be ruined from this, especially people that can't rest. So I've had a few people that are factory workers and they just have to stand all day long. So whenever they do more exercises or stretches, it just makes it worse. It's already chronically overloaded. So some strategies that you can do are use a boot to help take stress off. I had one lady that she was actually able to take a long vacation and just really rest her foot and heel enough that it actually helped when she got back to it. So sometimes rest is the most important thing. Maybe you can take a different job for a little while or substitute things or get a stroller, but sometimes just taking load off that foot and let it calm down is the only thing that's going to help get the pain down so you can start the other treatments. So if you have this pain for a long, long time, think about maybe how can you take stress off it for the next week or so and then start the exercises. Other conditions that can affect the bottom of your foot is an L5-S1 disc herniation. With this, you should also have back pain, and there will be a burning or electrical pain down your leg. There may also be numbness, tingling, or weakness in that foot, and an MRI should show the disc herniation, as well as there's positive nerve tension test. Tarsal tunnel syndrome. This is often shown as varicose veins, soft tissue tumor, or tenosynovitis. There's burning or shocky pain along the bottom of your foot, and this may also be associated with numbness. Baxter neuroma. This is an uncommon compression neuropathy of the first plantar nerve. This can be confirmed by MRI, which demonstrates atrophy of the abductor digit calcaneal stress fracture. History of osteopenia, osteoporosis, or other stress fractures. Younger, thin female athletes are higher at risk. Low BMI, runners, and this pain often presents over the posterior tuberosity of the calcaneus, and it's worse with activity. Thanks for watching our video, plantar fasciitis or plantar heel pain. This should give you everything that you've ever wanted to know and more. If you did find it beneficial, please like our video, subscribe to our channel, and don't forget to check out other great videos.